on?
So we've got a kid right now who will be our starting quarterback this year. We're starting to get some open fields where he's throwing. He does shot and jab for track. And right now, I would say we're throwing 60 to 70 balls in the morning, nothing crazy. Pretty standard pat and goes. We kind of do some really light shoulder activation stuff. Good kid in the weight room, so he's strong. He's just having some elbow issues, and not anything crazy. He kind of describes it as kind of being right here on the upper side of the elbow. Says when you throw it, it feels kind of like fire, and it almost sounds like curveball elbow or whatever you would hear out of kids. And I didn't know if that's jab, if it's a strain. We do some shoulder complex, but I really don't know anything about the elbow. So yeah.
Sure. All right, so he throws. They say he throws javelin.
Yep, throws javelin.
And he's a quarterback. Is he a pitcher too?
No baseball. No baseball.
Okay. What's he doing in the weight room right now?
As far as amount of weight?
Well, just as far as exercise that he's doing, how many times a week? What does his lifting schedule look like right now?
Sure. So he's in a weightlifting class through the school, so he'll lift 5 days a week. It's the end of the year, so they're maxing out right now. I want to say he's maxing 385 squat. I think he's probably right around 275 in the hang clean. So he's lifting. And they do some 5x5. They do have a day where they kind of do some CrossFit and try to keep everybody happy, I guess. But he is getting quite a bit of lifting in. I have him do the really basic old school kind of shoulder complex. Usually you do with a band. I'll have him do with a dumbbell, no more than 5 pounds right now, and just for reps. But that's really it. We don't really get into a whole lot of the specialized stuff. We will in the summer, but right now it's just a class. So he could lift with a tennis player, a basketball player, and a no sport athlete, like a no sport kid. So yeah.
Is he having a lot of pain right now? Like, what is how acute is his pain? Is he having it all the time? Is it just whenever he throws?
It sounds like just when he throws. We talked the warm up we do with pat and goes, and then just some light stuff. It takes about 15 minutes, and he says he's good. It's kind of when he really starts throwing, like we start to put a little bit more on the ball. I'm really kind of trying to change his mechanics, trying to go more toward the rotational thrower, rotational athlete, and a lot of the stuff you'll see with like QB motion and Rob Williams and Jeff Harper, trying to get away from like the old school, way up here and pull down and all that. So that might be some of it. I don't know. I just know that when it does, he says it hurts and throws, and then immediately, grabbing right above around the tricep and just kind of holding on. It's not the tricep, no shoulder. It's just, he says it just feels like when he lets it go, it feels really hot. Like it's all of a sudden, it's like a really sharp, warm pain. And it's like, okay, then usually we stop him, but we don't have him work through it. I'm not a big believer in that unless I'm crazy. So
how old is he?
17.
17. So he's already going through puberty and gone through the growth spurt. Okay.
He's already balding. So yeah.
Okay.
Yeah.
So. All right. So only hurts whenever he's throwing. And the location is kind of interesting. It's above the elbow, right?
Yeah.
Interesting. So your triceps does insert into the elbow right there.
Okay.
So he could have like a triceps tendonitis right there.
Okay.
Especially if it's during extension.
Sure.
Base movements. So if it's located right there, right where that triceps inserts into,
sure.
Anything where he's accelerating forward and then he has to stop that and decelerate, that's going to aggravate it a lot.
Okay.
There's a band called a Voodoo Philosophy band.
Okay.
That is really, really good for these tendonitis type injuries like this. Like if it's golfer's elbow, tennis elbow, patellar tendonitis at the knee, the knees and the elbows, it's really good for. But it's like an elastic, stretchy band that you can buy off. I think it's off of Rogue.com.
Okay.
And I'll send you a video of a protocol that a PT put together. Who's a really sharp guy. That he talks about how to put that on the elbow and like what to do with it. But that'll help. That'll actually, whenever the band is on, it'll take blood flow out. But
okay.
Whenever you take it off, it'll reperfuse that area and help it heal faster. Because we have to get blood flow to that area to help it heal.
Sure.
Also, whenever that tight band is on, whenever you're moving the elbow through ranges of motion with that on, it'll help that tendon slide over the fascia easier. So you'll get a better sliding and gliding of those tissues whenever you're doing that. And then the last thing I would say is he's going to need to do some soft tissue work, probably in that area, whether it's with like a yoga ball or a tennis ball, because I bet he has some trigger points in that tricep area. So those are all the localized things that he can do to help with that elbow pain. Now, we're looking at the global spectrum of the quarterback throwing motion specifically. There's some areas that he needs to look at, because if he's coming through and he's throwing, he can't decelerate very well. That elbow is going to take the brunt of that motion. So the deceleration part in that motion. So what we need to think about is, if you're looking at the throwing motion, is where does this front foot end? Because if he has some stiffness in his hips and he is ending way over here on this outside part of his foot, he's not going to decelerate through this leg very well, right? Because we would like to see him, as soon as he's coming through, we want to see the medial part, the inside part of that foot, coming down and through, so he can continue to produce that force coming forward. But as soon as that ball is released and he's coming through with his hand, we still have to maintain the balance. But if a lot of times what guys do is, if they're tight in this right hip, they'll have that lateral lean that you see all the time, that lateral lean to the left like this, and they'll have that leg come way far out to the side.
Yeah.
And which means all of the deceleration has to happen somewhere else rather than the trunk and the hips. And usually it's the elbow. And for a lot of guys, it can present differently, whether it's in that triceps tendon, that common tendon there, or if it's in the medial part of the elbow, where you get some golfer's elbow, tennis elbow, that kind of stuff too. So those are some things to think about just from a local perspective and a global perspective. You have to keep both of these things in mind, and also realize that the local perspective is going to be really, really important when it comes to everything acute. So we have to, like, the first goal would be to stop his pain. We have to get rid of this pain right away, and that'll usually last, I don't know, probably between 7 days and 14 days, a couple weeks. This type of inflammation that's present. So getting that under control is super important. One thing he doesn't want to do is ice too much, because what that does is that's going to prolong that inflammation cascade, which we need for proper healing. So I would say if he's going to ice it for 10 minutes, probably like twice a day. If it's hurting, if he's in pain, ice it for 10 minutes. That'll help the pain. Now, when it comes to the inflammation part of that, there's a lot of mixed literature when it comes to ice helping with actual inflammation. And in most cases, it shows that it just prolongs it. It actually can make it worse. So those are the localized effect is important early on. And then you got to think about everything else. So like stability in the shoulder is another area that's really important. Making sure that his motion, if it's compensated, if he's a leaner and he's bringing that up or down, that's a prime way to cause that elbow pain. He's going to lean, but he's got to still have the force of the ball, so he's going to rip that arm through, and it's not very mechanically sound. Right? And a lot of times that starts right here in this right hip, because I have to have good range of motion through that right hip, good stability through the trunk, good stability through that left leg, to be able to not only drive through my right hip, but be able to accept that force through my left leg as I get onto my plant foot and follow through. All right. So if I had to guess, I would bet that this is due to poor mechanics during his follow through. So as he comes through, he's one of these guys, and as he comes through, he's snapping the elbow down, and there's way too much force being put at that extension moment, because he's trying to produce too much power from here, and not from here. because he
Yep.
can't. Because there's something going on mechanically, either in the hips, the trunk, spine. We don't know, but that's usually the case. It's a localized effect that we have to think about in a localized manner first, but then try to figure out what's causing the bigger problem. Because it's almost like this first part of this is trying to put the Band-Aid on the gushing wound, but then we have to figure out the bigger issue to make sure that wound stops for
Sure.
good, right?
Yes, sir.
So that's kind of the way to like organize it and think about it in a model that you
Okay.
can use to try and help with it. Um, but I would say manage the pain first. And I don't mind looking at his motion. So if you get a video of his motion
Yeah.
and send it to me, I can look at it and try to guess the best of my ability where his issue's at, and maybe try to give you some intervention to help with that too.
Sure. Yeah. I've got a couple here. We had a really good thing going. We were throwing in the spring, and he was doing a better job at being grounded and really rotating straight up. But you'll see he's very much here, all this. And if I'm behind him, it looks like a J. The front hip comes way too far open.
Yeah.
Anything that we really have to get some velo on, he'll get up on the toe. I mean, you can see the calf explode, and he's up, and everything is here. He looks like he's falling off a mount, and he's never pitched. So 100% with what you're saying, like no doubt.
Super common. I mean, that's out of all the guys that we've worked, I mean, 75% of the guys that we work with initially, look like this. They present like this. Yeah,
for sure.
we did that.
Yeah.
I'll show you a picture here. This is my uncle at Notre Dame playing, and look at him.
Just ripping it.
I mean, but look, that's just the same issue, right? Same problem, and it's one of those things that's going to run rampant until what we do like becomes more mainstream, right? And that's what we're trying to do is like these 3 silos of strength conditioning, quarterback specific training, and then rehab or like training room. There's too big of gaps between those 3 silos right now. So it's just an uphill battle for every quarterback, because strength conditioning coaches want to put those guys in the weight room and to lift like everybody else to build power, speed, and strength.
Yeah.
And whenever they do that, once you get to a certain threshold, at some point you're going to start robbing ranges of motion from the spine, shoulders, and hips, which causes the compensations that you see every day, whether it be the lateral lean or this trailing hip that we see all the time, where it's one of these, or like the foot stays out while I come through with my hips. You see this all the time. Well, if this is like this, if my foot is an external rotation, then I'm going to extend my back no matter what, right? At my release. And then if I'm extended and I just change my position of my trunk, well, my arm's going to travel behind my torso, which I'm going to miss high.
Yeah.
A lot. I mean, a ton. So it starts from the ground up, but then you have to be good at figuring out where the actual issue is, identifying it, and then figuring out the specific prescription for that individual to get them back to where they need to be. And that's the tough part, because we can evaluate and look, but then it's all about trial and error, trying to figure out probabilities of how to help this guy move forward. And it's tough. It's really the training a quarterback can be hard, because you're trying to manage all these different things, and it's hard to tell a high school player, hey, you can't bench, squat, and clean. Those are off the table, because that's going to make your shoulder issue worse. And that coach says, oh, you can get through it. Just you got to practice through pain. You got to play through pain. And it's like, no, like don't do that.
No, and it doesn't help, because he does have a great weight room work ethic, but like you don't get that without throwing a big weight. But it's like, hey, that's great, but right now you're 5'10", 220 pounds, and you're massive, which is, hey, yeah, like cool, I get it. I'm a shorter guy, but it's like just because you're a shorter guy does not mean you have to be a bowling ball. We don't have to compensate vertically and horizontally, And the other thing I don't want to do, So let me back up.
Yeah.
Next week or last week of school, and then we have a dead week. So he's going to get a good amount of rest, which is nice. This will help with this. But like you said, I don't want to just put a Band-Aid on this. I don't want to say ice. He doesn't throw for a week, feels good. We get to camp, and then we're doing this dance all over again, because at that point there's no growth. Both as a coach and a play caller, everything changes for what his limitations now are because of an injury, et cetera, et cetera. It just turns into this massive ordeal. So yeah, I want to get ahead of this is like now, if we have to suffer a little bit with, hey, he's not going to get a ton of reps today, or we're doing whatever. If we have to, that's fine. That's how we do it. So yeah,
Sure. For sure.
So,
Well, just
yeah.
send me his motion.
Yeah.
And then I'll look at it and I'll kind of give you my feedback on what I think's going on. And
Sure.
then after that, have him get that Voodoo Philosophy in, because that will help a lot in the short term. And then as he's resting this thing, we can try to figure out what's going on. I can send you some videos of some things he can start to do.
That'd be great.
To kind of mitigate some of the things. Because that's the thing, is you can buffer some of these things that you're doing in the weight room too with some other exercises.
Sure.
That are specific to where the issue's at. So I think that's going to be the most important thing, is selecting the right exercises to buffer and mitigate and maybe try to improve a little bit the area where he lacks to help his mechanics. It's either because there's, in our minds, there's the technical aspect of the actual performance, like what you're doing. So like the throwing motion, that'd be like the technical bucket. But then there's the mechanical bucket of how is the body moving as a unit to produce the actual motion. So if I do have a problem in the system, then the mechanical issue is going to cause a technical issue. Does that make sense?
Absolutely.
And it can happen vice versa too. Those things go back and forth. It's like the chicken or the egg. What came first? We don't know, but we know that they're affecting each other.